So I'm so glad you guys took some time out this morning to just kind of take about 30 to 40 minutes and kind of talk about what exactly we look at when we see all the kiddos that we have with autism. So one of the biggest things is this picture right here is my wife. This is a picture of my wonderful wife, Christy, my oldest, Kinley, and my youngest, Brooklyn. So when I was going to chiropractic school, obviously I wanted to be a family chiropractor, kind of wanted to do sports and things like that. But then learning about the nervous system, also, whenever I had these two little ones, changed my perspective. I saw firsthand kind of the traditional kind of obstetrics birthing process, what my wife and I kind of went through there during that process. And it really showed me that the amount of stress that these kiddos go through are astronomical. Now, I personally do not have a child with autism. However, I do have very close family members, just like almost everybody, that has either autism or some sort of sensory processing, or they're on the spectrum one way or another. The amount and rates of autistic numbers are just growing so much recently that everybody knows somebody that has autism. So today, what we're really going to look at is what is the perfect storm and what are kind of some of those deep dive into the root causes of what leads that child down the path of potentially autism, colic, issues like that. So the first thing, sorry, I've got a lot of slides. We'll kind of jump back and forth a little bit. So what exactly are we talking about when we say the perfect storm? The perfect storm is basically what are the ingredients that can happen with that child where basically their nervous system gets stuck in such a stressed, sympathetic, overloaded position that their body doesn't process and communicate properly. So things that can happen is they can have significant mental and emotional distress during the prenatal period, which is very, very important. We'll dive a little bit deeper into that later on. Medical intervention and labor delivery. This can be inductions, epidurals, C-sections, forceps, vacuum extractions. We see this when kiddos come in. This happens in about 60 to 80% of all of the case histories of kiddos that come in with autism. We see that there was some sort of birth trauma or birth intervention. And again, we'll dive a little bit deeper later on. And then last is they could be stressed, colicky, constipated. A lot of times parents will hear from the pediatrician that they will grow out of this issue. It could be colic, it could be constipation, it could be some sort of other developmental disorder. And what we're told most of the time is as they get older, they will not have that problem anymore. But what we see through tons and tons of case histories is that colicky child will then lead to autism or ADHD or some sort of sensory processing disorder because we never figure out the root cause. The root cause boils down to the simple state of our body or that child's body is stuck in a state of fight or flight where their sympathetic nervous system is stuck on the gas pedal all day, every day. When that happens, you cannot allow your body to process signals going to the brain properly, and confusion occurs. We get improper communication back down to the body, and things start to go a little bit. You start having dysregulation. So another thing is if you have a kiddo that is constantly sick, they're challenging. So again, colicky, constipated baby then turns into a constantly sick, challenging toddler. Then we lead to a hyperactive, emotionally child. So I've got a 6-year-old and a 3-year-old right now. So we just had spring break. Spring break was a big neuro detox because you don't have all those sensory things. But what we notice, even with Kinley, is that first few days back at school, she is up here on that sensory overload. Well, even the kiddos where you can process properly, that is still an extreme stressful time for them. So in our kiddos where we can't process and we can't handle that stress because our cup is already overflowing in the stress mode, that is where we start really diving deep into, okay, what is actually going on? What can we do to figure out how do we drain that bucket? How do we allow their body to handle, adapt to that stress? Because we're all going to have stress on us. It's how does our body deal with that stress, process that stress so that it can function in a better state. And then lastly, those sick, stuck childs or hyperactive kids, they then turn into angry, anxious, depressed teenagers. And lastly, we see this a lot in our office, burnout, stressed out, anxious, and ADHD adults. So we never lose that state of sympathetic dominance if we don't go all the way to that root cause and really figure out what is going on. Why is that nervous system stuck in a state of fight or flight? Because if we don't, we'll always just have a different diagnosis, but it stems back to that same root cause. And that's the biggest thing that we want to look at is what's causing our kiddos to be in that state. Now, in our office, our goal whenever you come in is to not look at the numbers, not look at kind of what is that diagnosis, but really we want to dive deep into the root cause. And how we do that is we really pride ourselves on listening to the parents. You guys are so amazing. All of our autism parents, you guys are rock stars. You take all the toxins out of the household. You do all the whole organic foods, you do an anti-inflammatory diet, you basically have done everything you possibly can to get your kiddos in a better state. And that is so huge. And they are so lucky to have that. But what we have to do is say, okay, we are doing everything we can from what we've been told, but what is the missing link? What is there that's still causing them to be in that state of fight or flight? And how do we fix that? So basically today, what we're going to do is we're going to talk about how are kids designed to deal with stress and health, and basically what potential do they have to heal. So one of the things that we're really going to dive into is the science. What exactly do we find when we look at the case history? So if you're talking about science with kind of traditional medical field, things like that, it's, hey, you have a diagnosis, here's medication, here's the typical thing that you need to do because that's what your diagnosis tells us. Well, that is a very superficial way for us to look at it because every single person is different. Every single person responds differently to that same stress. Medications for this diagnosis are not going to help every kid the same way. So what we do is, again, we sit down with the parent. We want to find out, okay, through that case history, what is their experience? What has happened from the time that they conceived throughout the prenatal period, birthing process, and now into their early life? What can we do to basically get them and figure out what could be that root cause? What can be the issue that's causing them to have that problem? And then what we do is we look at patterns. We've had tons and tons of case histories on kiddos with autism. And what we've seen is there's patterns that can lead to autism cases. When we talk about the mainstream media, one of the biggest things, if you asked 10 or 15 years ago, what causes autism? Most of the time you'll probably hear it's genetic, it may be bad luck, but there is nothing, sorry about that. There is nothing that basically can give them a reason to explain why these kiddos may have it. It's just happenstance, it's genetic. Now, I'm not saying there's not genetics that can be involved. However, we know that there's a difference between being genetically predispositioned and genetically predetermined. Genetic predisposition, or also known as epigenetics, basically tells us that our environment guides us in that stress. So if we can remove those thoughts and toxins out of our environment, we can actually increase the chance that we are able to reduce the potential of having things like autism, ADHD, because it comes down to what we call the 3 T's: thoughts, traumas, and toxins. And we'll dive a little bit into that in a minute. But before we go any more in this kind of webinar, I've got a video I want you to watch, and it's going to kind of guide you through what to look for. But take a look at this real quick. Give me 1 second. There we go.
This is an awareness test. How many passes does the team in white make? The answer.
How many did you guys get? Comment below if you have the answer to that real quick.
Is 13. But did you see the moonwalking bear?
So that video right there really is the forefront of why we do what we do. When we look at the medical realm, our whole focus in the traditional medical realm is what is the diagnosis? What are the symptoms telling us? Excuse me. And then what do we need to do based on that diagnosis? We're less looking at why do we have this signs and symptoms? What are these signs and symptoms really trying to tell us? And what can we do to set aside and look deeper into the issue? Because every profession has its own lens. MD, a DO, a neurologist, a pediatric chiropractor, a OT, PT, everybody is amazing at their specialty. We work with some amazing MDs, pediatricians, OTs, PTs, but everybody looks through things in their own lens. So the lens that we are looking through is based on neurological stress. Really, what is the first thing that can happen? What can we do as neurologically focused pediatric chiropractors? Can we do to set that child up to have the best chance of properly functioning nervous system and being able to adapt to that stress as possible? So going kind of back to what's the difference between genetic predisposition and kind of the medical realm of genetic predetermination. Predisposition basically means that your body has the chance and the ability to go a certain way, but you can alter that by focusing on releasing the environmental stress. Predetermination basically is like, hey, you've been handed this deck of cards. There's nothing you can do to make it better or worse because you are predetermined to have this problem. That is more along the lines of kind of traditional diagnosis and aspects. However, we are seeing some amazing changes in kind of the pediatric atmosphere with our OTs and PTs that they're seeing that there is environmental stress. There's other things that can actually be causing or increasing the chances of having some of these autistic cases. So a lot of times when we're looking for answers, we're diving deep, we're looking at research and things like that. But many, many times the answers are right in front of us, and it's the hardest thing for us to see. When we look at kiddos, what we found is pregnancy, labor and delivery, antibiotics, and toxins are the three biggest factors that can either help or kind of hinder that developmental process. Those are the three aspects that we really dive into when we do our case history. And we know that autism, there's no single factor. Autism isn't due to one thing. What it is, it's a combination of things, basically that's built up to what we call the perfect storm, like we talked about here. The perfect storm is a sequence of toxic load that basically puts the nervous system in stress during that most formative time. So the nervous system and the spinal cord is the very first thing that develops in utero. And your body, God developed our spine and our body to protect that most important thing, which is your spinal cord, your brain, and your nervous system. That should show us how important that nervous system really is to us. Now, a lot of times what we look at is we look at the stress in utero as far as, okay, in today's world, parents know, hey, we shouldn't drink alcohol, we shouldn't smoke, we shouldn't eat these foods or take this medication while we're pregnant, because we know that your stomach, the umbilical cord goes to the fetus, it carries nutrients, it carries blood flow. However, your umbilical cord also carries neurology. It carries nerves from mom to baby. So one thing that we see time and time again during case history is that there is some sort of stress on mom, either during fertility, conception, or there's stress during the pregnancy period. So this could be moving stress. It could be stressful jobs. I know, for instance, when Christy was pregnant with our first one, we were constantly going because she was right on the border of pre-hypertension. So we were going 2 times a week to do fetal heart rate testing. That put her under loads and loads of stress, because every time that we were going in, basically they were saying, hey, there could be something wrong with your child. That puts a ton of emotional stress on the parent, and that stress directly goes to that fetus. That is probably the single biggest thing that we don't look at in that prenatal period in modern medicine, is what kind of emotional stress does mom have while she's pregnant. We look at the toxins, we look at the traumas, but we don't look at the emotional stress aspect to that. And that's the single most important thing. So real quick, I want to dive into something called the 3 T's. The 3 T's are kind of our building block, our foundation for everything that we do. This goes for autism kiddos. It goes for anybody that's on the spectrum, adults, moms. Those 3 T's are thoughts, traumas, and toxins. Those are also known as chemical, physical, and emotional stress. Now, today we're going to talk about kind of 2 out of those 3. And what we're going to do is actually a webinar in and of itself on toxins, because that is a huge, huge talking point. We're going to have some guests on that do that in more detail. So today we're going to go a little bit more into the thoughts and traumas. So when we talk about those triggers, we have fertility and prenatal stress, birth trauma, birth intervention, which again, that happens in about 70 or 85 to 90% of people. And then we have early use and exposure to antibiotics and toxins. Again, that's on a separate date. So when we're talking about the stress in the mom, we know that if mom is under a lot of stress, she gets stuck in what's called a sympathetic dominant central nervous system fight or flight. You have 2 halves of your nervous system. You have your fight or flight, your sympathetic, and then you have your parasympathetic. The way your nervous system works is you can't be in both at the same time. So one gets high, one gets low, and vice versa. Your sympathetic side is where you go into full protection mode. That's when you feel like your body tenses up, heart rate increases, breathing rate increases. Our mental acuity actually lowers during those times of fight or flight. Vice versa, your parasympathetic is your rest, digestion. But more importantly, research is now coming out that also has a lot to do with socialization, emotional regulation, and also regulation of inflammation. We're going to dive a little bit into that when we get more into the kiddos. But real quick, let's stay with the parent, with the mom. So when we get stuck in a sympathetic dominant state, we lower that parasympathetic side. Well, what causes, or what's the issue with that? Your parasympathetic has what's called a vagus nerve. Your vagus nerve is something that, let me get out of here real quick. There we go. Your vagus nerve is the afferent connection between every single organ in your body and your brain. Again, every single organ connects to your brain afferently, which basically means it's what sends all the sensory up to your brain, is done by that vagus nerve. That is the sensory of your autonomic nervous system. So if you have a mom that is always emotionally stressed during pregnancy, that child will start their neurological development also in a sympathetic dominance stress. That means that while they're in the most developmental state of their nervous system in utero, they will already be in a state of fight or flight. Then, once they go through the delivery process, the trauma, the stress that goes through, they're still stuck in that sympathetic overload. And if they never get out of that, their nervous system learns sympathetic dominance. The vagus nerve does not function properly. It does not communicate from the body to the brain properly. And that's when we start getting, again, colic, gut issues, digestion issues in kiddos, because the vagus nerve is shut down. But the vagus nerve many times is not damaged. Just because you have dysfunction does not mean it's damaged. What we find most of the time is that the vagus nerve is basically, it's underdeveloped. So your vagus nerve, as you develop or as that child develops, the nervous system learns, it processes. That's why the first couple years of life, how fast they learn to do things compared to, I'm now 35, it takes a lot of work to teach me new things. Whereas a kiddo, they learn so much so quickly. But if they are dealing with that sympathetic side, that is what their brain, their computer is learning. So when that happens, the vagus, the parasympathetic side that gives you that rest, digestion, emotional regulation, that is not functioning because it's diminished due to that sympathetic overload. So what we see when we get kiddos in is we have scans, and we'll talk about that in a second. We can actually see on those scans how balanced their nervous system is. Well, kiddos that come in an extreme sympathetic dominance, it takes time, but we watch that nervous system change and balance out and go more towards a parasympathetic dominance. That is where we start seeing emotional balance. We start seeing their communication increase. We start seeing their alertiveness increase because they can start processing things correctly. Sorry, guys, if you can hear that. But that is what we see a lot of times with our autism cases, is all the pieces to the puzzle are there. They're just not in the right order, and they're not functioning in the right direction. So what we have to do, it goes all the way back to what we started with. What is the root cause? What exactly happened in that individual instance? Was it maternal stress? Was it something that happened during delivery? Is it something kind of post-delivery with the environmental stress, the epigenetics, things like that? What do we need to do for that unique case to dive deeper into figuring out, okay, what's the key to unlocking this goal? And again, it all comes down to case history. It sounds simple, but it's the truest thing that we can say. Moms, you guys know, you have that gut feeling what you feel like is going on with your child, and we want you to tell us how you feel, and then we're going to take what you say and take those scans and see if we can figure out what is the key to unlock that. Now, when we talk about birth trauma, that's the second biggest thing that we see when we deal with autism. Birth trauma or birth intervention. Now, if you look it up in research, you may need to look up birth augmentation. That's kind of a new word that they're throwing out there in some of the research. That is the single biggest missing link in modern medicine. We look at toxins, we look at so many things, but we never look at what happens to that newborn during the most important time of their life, during that birthing process. That is the time where they go from full protection in utero to experiencing gravity, experiencing environmental stress. For the first time, they have to breathe on their own, they have to function on their own. But what goes during that time is extremely, extremely traumatic. So, guys, I'm going to show something really quick. If you've got kiddos around, this will be a little bit graphic. So, kind of forewarning. So, what I'm going to show you is why do we say birth trauma can be so impactful? Again, this goes back to that moonwalking bear video. Things can look normal unless we look through the lens of looking for the why. If we look for, okay, why is this happening? A lot of times the answers are right in front of us. So this is a typical C-section delivery. Oh, there you go. Come on, bud. Oh, there you go. Come on, buddy. Here's the girl. Here's the girl. Make you for the camera. Oh, he's coming back. That video is extremely, extremely traumatic. That video right there is why we see so many kids coming into our office at such a young age that has neurological problems. The amount of torque and tension and stress that's put on that child's head before they even experience gravity. A child does not have the muscle strength to hold their head up, to do anything, yet during that delivery, we are basically grabbing the head, putting extreme torque, extreme traction on that little one's head without any care in the world. They were whistling, laughing, having a great time. That is right there worse than any car crash that we'll have as an adult. How many times have you picked up a new one and because their muscles haven't developed and they haven't processed, how many times have you felt things move when you pick up a newborn? Think of what happens if you were to take a newborn or your newborn and you were to do that to their neck. That could be grounds of assault. That's how traumatic that tension and that torque is. So why is that important? We know the sooner we can get these kiddos checked and see that there's stress there. What is happening in the upper part of your neck? The upper part of your neck has your brainstem and the key to your entire brain function. The way your body develops is from the ground up, back forward. Your cerebellum has a lot to do with processing, and then it goes to the prefrontal cortex. When your child has trauma, whether it's a VBAC, there still can be trauma with a VBAC, but especially any sort of C-section or birth intervention, because now I'm not saying these docs are bad. There's a time and place for everything. Modern medicine on saving life is amazing, and it is one of the greatest things that we have. However, it should be done at a certain time and place. That right there should not be the norm. And unfortunately, what we see is the amount of C-sections and things like that that are happening in today's world continues to increase year after year. Although we aren't looking at what are the consequences of these C-sections. Again, if the number of autism rates continue to increase, why is that happening? humans haven't changed over the last 2 decades. However, our environment has changed, our chemicals have changed, and also we're changing what are the rates of these birth traumas, birth interventions, and if that happens, what do we need to do to set that child up for a better chance of overcoming that stress? So one thing that we know, so this is a graph kind of explaining what I'm talking about. So if you look in the 70s, and every decade it almost doubles. But now we are 33% more common than we were in the 70s, and that's just 2012. If we had an updated graph through 2022, 2024, it's even higher. So we know that, okay, we're having more of these rates, we're getting more of these diagnoses. Why is that happening? If it was truly genetics and we were truly dispositioned to be in that state, there would be nothing we could do to fix it. But if we are predisposed genetically, but it's the environment, it's the chemical, physical, emotional stress that's putting the nervous system at a deficit during the most developmental state, we're asking the body to do something it's not able to do. So your nervous system, we're talking about electricity here. Your nervous system is the electrical circuit that runs the body. So think of your house. You have electricity that goes to your house. Your spinal cord is like the electricity in the house. You have to plug something into the outlets for that to work. You have nerves that go off of your spinal cord that connect to every organ, muscle, cell in your body. But you have that vagus nerve we talked about that goes from the brain to every organ. If that electrical circuit is damaged, it's not going to communicate and function properly. So your body is always trying to tell your brain where it needs help, where it needs something to fix it. But if that communication is altered, the output from the brain to the body is also going to be improper and altered. So one thing that we know, and this is an article here, this is actually by a osteopathic journal. And what they found when they did this research, 99 out of 100 infants had at least a pattern of subluxation. This was not done by a chiropractic journal. This is actually done by a DO, or they're more in line with kind of MDs these days, because that's a lot of the OBGYNs or DOs these days. What they found, 99% of kids at the time of birth have at least one subluxation. What does a subluxation mean? So subluxation basically means that your body is stuck in stress. So what happens? We're talking about, excuse me, we're talking about how the brain communicates with the body. So here's some references. We have science to back all of this up. Feel free to reach out to me. I can send you all of the links to have all of these amazing studies, because we're starting to see a shift that there is research showing birth trauma, prenatal stress, birth intervention, they have direct effects on these autistic issues. So there is things that we can do to work on it. So dysautonomia basically is how the body, how that autonomic, that vagus nerve communicates to the brain. So dysautonomia basically means improper autonomic nervous system. So this is the different parts of the brain, how they function. But this right here is huge. This is what we call the gas versus brake analogy. What we know is the more of those 3 T's your body deals with, the greater chance that it cannot adapt to that stress. However, we talked about thoughts, traumas, and toxins. And we talked about that prenatal stress, emotional stress. If you were to cover up the green and the blue, I can't do it here, but if you were to cover up the green and the blue and you just left the thoughts, what that means is you would be in that far extreme state of fight or flight. the emotional stress is the fastest thing that can throw your body into sympathetic dominance greater than anything else. That's for adults, that's for kids. So, easiest way to think of this is we all drive here in Leland, we have 17. You drive down 17, you're probably going to get cut off every other day at least. What happens to your body as soon as somebody cuts you off? You go really tense, everything just gets heightened. Your senses get heightened, but your mental acuity goes down. We kind of talked about that earlier. Same thing happens on those kiddos. The problem is they can't tell us because they haven't learned speech yet. So we are trying to base everything off of, okay, what are they telling us with their signals, with their nonverbal? That is why we need these scans to see exactly what's happening, to see what level of stress is in their body, what level of the spine is affected, because we don't adjust because a bone is rotated. That is kind of one of the nuance, unfortunately, of how chiropractic kind of went down the state it did. But chiropractic was founded because a man lost his hearing and got an adjustment and regained his hearing. That is a neurological change. And that is how chiropractic was founded in 1895 or discovered in 1895. So over 100 years ago, D.D. Palmer knew that there was something that connected your nervous system to function. And that is what we do when we work on pediatric chiropractic, is we look at where is that neurological stress and what is your body when it is producing signs and symptoms. What is it trying to tell us? What can we listen to those problems and say, okay, this is the result. What is the cause? So case history, neuroscans, listening and doing our own palpation and talking with OTs. We have great relationships with pediatric OTs, PTs, speech therapists, because they see things and they look through a lens. That is more information for us to really find that root cause. So this is definitely not a webinar to say, hey, don't do anything else, because our job is to unlock the stress, allow the brain and body to communicate, and set that child up to have less sympathetic stress and more parasympathetic dominance. And that will allow all of those PTs, OTs, speech therapies to be 10 times better, because now your brain can process those signals going in. It can process, how are we supposed to communicate? How are we supposed to have attention? It slows that fight or flight down, and it takes the foot off the gas pedal. Because what happens when we see most kiddos with autism, they're having emotional outbursts. They're not listening. They're not paying attention. Because when we think about your brain, your body's sending all of these signals to the brain. Your brain is like again, I've got a 6 and a 3-year-old. I think of a room full of kids. If I'm in a room full of 23-year-olds and all 20 kids are screaming at me at one time, there's no way that I can hear every single kid at once. However, what happens is I hear the one or two loudest. That's what happens in our body when we're in fight or flight. Your body is trying to tell your brain what's going on, but there's so much noise, there's so much chatter, it can't process correctly because it's going too fast. But it hears the one or two most significant issues. And sometimes those are not the best ones for it to hear at that point. It's out of order. So just because it hears it doesn't mean it's the right order to correct the problem. So what we do as chiropractors, we find the area of stress. We work on reducing that stress. So then instead of 20 kids yelling, it's only one or two talking without yelling at a calm voice to communicate. That's what we see time and time again with kiddos that come in stuck in that fight or flight, dealing with those autistic diagnoses, is their body cannot process. It can't communicate, but it has all the tools. It has all the pieces to the puzzle. We just have to set the right order. We have to set the right communication protocol, and then we have to get out the way. That's one of the biggest things that we don't do in our culture, is we have to allow the body to do what it's great at, and that's healing. When you cut your finger, you clot. When you get injured, your body can function. Your body knows what it needs. However, there's a limitation of matter. If your nervous system isn't communicating, if we have too much of those stressors on our nervous system, it just reaches a point where it can't adapt anymore. That is when we start seeing these autism diagnoses, the colicky kids, the overstressed pediatrics. What we know is over the last 5 years or so, we are seeing a huge shift in overall health. And that is something that I'm super excited about, because sometimes listening to your mom gut, listening and knowing that, hey, there's something going on with my child, but it's not where they don't need all these medications. They don't need this. We need to look at what is really the root cause. Did I have stress during pregnancy? Was there something during that prenatal period that could have set their nervous system in a sympathetic dominance? Was there some sort of birth intervention or birth trauma that could have put them in that sympathetic overload? Did we do antibiotics or toxins or something at an early age that could have predisposed them into that environmental toxins? What is really giving it that root cause, and what can we do to get as many of those thoughts, traumas, and toxins out of the body, allow your body to communicate with your brain, and just see amazing things happen? The greatest thing for me is I had a mom the other day, this just as simple as can be. She said, my child ate bananas for the first time. And that may not be something that sounds amazing, but this is a kiddo that we are really trying to get just to focus, to slow down, to just communicate. And the fact that he's starting to show attention, listen when they're talking to him, he was willing to try something new. That was such a huge thing. And it's what we call soft signs. It's not the end goal, but it's little signs that we're seeing that his nervous system is starting that process of relearning, rehabilitating, and getting out of that state of sympathetic dominance and more into that parasympathetic, where it can rest, digest, emotional regulation, socialization, and also reduce inflammation. So, parents, what can you guys do if this is something that you feel like, hey, my kiddo may be in this sympathetic dominance, or we're dealing with this autism, or even if it's not autism, if it's any sensory processing, any kind of motor speech delays? Again, we work hand in hand with those amazing therapists, because you need a team. It takes a village to raise these kiddos, but it also takes a village to get them out of that fight or flight. But we've got to get the brain and body communicating better. So real quick, we didn't have a ton of time. I'm kind of running short. I'm trying to keep this within about that 45-minute window. This right here is an example of some of the scans that we do. So when you come in for your day one, we're going to do that case history, but we're also going to do these neuro scans. So what these are different layers of stress. We have thermography, we have SEMG, we have HRV. Each one of these scans gives us a little bit different insight to what is really going on in your child. And we are able to take these objective scans, and as we progress through that care plan that's individualized for each kiddo, we're able to see how much progress are we making, or where are we still a little bit stuck? Where do we need to focus? What is still holding up that progress? So it's not just basing it off of the signs and symptoms. We love using science to allow us to see deeper the root cause, and that is why we use these scans in our office. So real quick, I'm going to play one little video. I've got some, but I'm just going to play this one really quick. So this is Evan. So this is kind of an example of how the body and brain doesn't function whenever it's subluxated. And after this, we'll take some Q&As real quick.
Bye, Kristen. Oh, no? Did you have fun? Did you have fun? Yes? Yes? Do you love Aunt Kristen? Say yes. Yeah.
So that was Evan before he started, and this is Evan now.
Okay. What's that one? Goofy. What is it? Goofy. A dog? Yes, yeah. What's that? A truck. Fast truck. What's that one?
So this is about 3 months of chiropractic care. So what that shows us is we have the pieces to the puzzle. We just have to unlock that stress, reset that proper order. And on this re-exam questionnaire, mom said that he's more balanced walking. He's talking like crazy and he's following directions. Again, parents, some of the soft signs mean the most important to us, because if we're starting to be able to have that attention of our kiddos, see that there is things starting to change, we know the body can heal as long as we get out the way and get those thoughts, traumas, and toxins out of the system to allow it to process. So if you guys know that it's something that you want to do, give our office a call. Let us know. Also, if you have any questions real quick, we're going to take about 10 minutes to do any Q&As if you have any. So feel free to ask. If not, that's perfectly fine. You're more than welcome to reach out to us, DM us, give us a call. We'd love to talk to you a little bit deeper. Again, I'm trying to keep this one in about 45 minutes, so I'm kind of running short on time here. But yes, if there's anything you need, first and foremost, continue to ask questions. Listen to your mom gut. More times than not, that mom gut is going to be better than any doctor that you talk to, because you know your child. You have that neurological connection to your child. And it reduce those 3 T's: chemical, physical, emotional stress. Again, we're going to have a separate webinar on the toxins and things that we can do for those kind of reducing the toxins in the household and those environmental toxins. And lastly, schedule those scans for your child and get that individualized report of findings and case history, because with that direct objective information, we can attack that root cause exactly where it's at and not wait to see how those signs and symptoms guide us. So guys, thank you so much for just hanging out with us today. Again, real quick, I'm going to check, see if we have any Q&As. If not, that's perfectly fine. So far, it doesn't look like we have too many. But again, feel free to reach out to us. If you have any questions, you can give us a call. You can like it or send us a message on Facebook. Any way that you can find us, get in touch with us. We'd be more than happy to kind of communicate back and forth. And also, keep an eye out. We've got another webinar coming out at the end of this month. And every month we're going to have these webinars, because the goal for us is to educate our community. We know that you guys are looking for answers. You guys know that there's more to health than just getting that diagnosis and getting that medication. God designed our bodies amazing. He designed our bodies to function. But what happens is at some point in time, our bodies get overstressed. And when it gets stuck in that stress, we start to get dysfunction. So maybe at another date, we'll do a webinar of what's called the 10 Ds, but it really is kind of the science, the nerdy part of really what happens. So if you guys are interested in that, kind of send us a message or give us a comment that you'd like to do that 10D webinar. Maybe we can get Dr. Nicole or another doc on here with that. And guys, thank you so much. Let me check one more time. All right, I don't see too many chats, so I'm going to go ahead and close this out right now. But again, feel free to let us know if you have any questions and get your kiddo scanned. What we'll do is, if you are on this call, give our office a call. Let them know you were on this webinar, or you saw it on this webinar. We're actually going to do a 50% discount for their day one to get those scans. So normally when you come in, it's $100 or it's $150 for their day one. what I'm going to do for this, if you're coming in off of this webinar, we're going to do that day one for $49. So the goal for this is to figure out, okay, where's the stress? What do we need to do to fix it so that you as a parent have that information? Again, thank you guys so much for hanging out with us. You've been great.